Good morning, sir. Do you have OCD?
Yeah, how did you know?
I just saw you spending 10 minutes locking and unlocking your door outside your house. Would you like to be interviewed?
Sure.
Okay, come with me. To start off, can you tell me something about yourself?
Every day before I leave the house, I lock and unlock the door 4,000 times before finally locking it and leaving it.
Wow, that's quite excessive. I can't imagine locking it more than once when I leave the house.
Oh. Okay.
So would you say OCD has affected your everyday life?
OCD has caused me to have extreme obsessions and compulsions that I can't control.
Can you elaborate on these obsessions and compulsions?
Well, to start off, I wash my hands exactly 37 times a day so that I don't get cancer. I also have to turn on and off the stove 10 times a day every time I leave the house to make sure that the stove is completely off and that the house won't burn down in flames and that I won't get lung cancer.
Would you say that OCD is very time consuming?
Yeah, probably.
And are you getting treatment for your OCD?
Yes. I get cognitive behavioral psychotherapy and I take drugs.
How do these treatments work and how do they help treat your OCD?
The therapy helps me to identify the things that trigger my obsessions. This will then lead to steps to control my compulsive behavior and rituals.
Have you noticed any improvement with this treatment?
Yes. I used to wash my hands 38 times.
Okay guys, we're gonna go find the OCD therapist for Jaden. Hi, good afternoon. Would you like to be interviewed for your role as a therapist for OCD?
Yeah, sure.
Okay, come with me. To start off, can you give me the description and the definition of the disorder in the DSM-5?
Yeah, sure. It is the presence of obsessions, compulsions, or both. Obsessions are defined by recurrent and persistent thoughts, urges, or impulses that are experienced as intrusive and unwanted. It causes anxiety and distress in most individuals. Compulsions are defined by repetitive behaviors like hand washing and repeated checking, or mental acts such as praying, counting, and repeating words are actions that individuals feel driven to perform in response to an obsession or according to the rules that must have been applied. The behaviors or mental acts are aimed at preventing or reducing anxiety or distress or preventing some dreaded event or situation. However, these behaviors or mental acts are not connected in a realistic way with what they are designed to neutralize or prevent or clearly excessive.
Would you be able to tell me about the symptoms and causes?
Some possible causes could include the individual feeling compelled to perform in response to obsessions or according to rules that must be followed rigidly. People with OCD have lower stress tolerance than most people, so their stress is triggered very easily and excessively. It can cause significant anxiety. They do things in multiples, like the number 5, for example, because it is a good number. People with OCD realize that their behaviors are irrational, but they can't stop or control it.
Wow, thanks. Next I'm gonna need some statistics on OCD. How many people in Canada have OCD?
Approximately 1 to 2% of people in Canada suffer from OCD. The majority of people that have OCD are females.
How and when does OCD form?
OCD occurs most commonly in early adolescence and early childhood.
What are the different possibilities of treatment that you could use for OCD?
Psychodynamic. They try to understand the patient's current symptoms by exploring their childhood experiences and repressed information to see the unconscious roots of the problem. Rather than undoing the past, they focus on helping patients improve their relationship skills. Humanistic. Aim to boost self-fulfillment by helping people grow in self-awareness and self-acceptance. Focus on the present and future more than the past. They explore feelings as they occur rather than achieving insights into the childhood origins of the feelings. Conscious rather than unconscious thoughts, and it promotes growth rather than cures illness. Behavioral therapy. They believe behaviors are the problem. Instead of trying to resolve a presumed underlying problem, they apply learning principles to eliminate unwanted behaviors. Cognitive therapy. Therapy that teaches people how new and more adaptive ways of thinking and acting, based on the assumption that thoughts intervene between events and our emotional reactions. The best method of therapy is cognitive behavioral therapy, where we can focus on the behaviors of the OCD and change the negative self-thinking into positive thinking. This integrated therapy combines cognitive therapy and behavioral therapy. The cognitive aspects deals with the self, meaning the irrational feels that the patient experiences. Through cognitive therapy, the patient learns to overcome these fears. The behavioral aspect refers to changing their odd behaviors, resulting them in not having to perform rituals.
Wow, that was very insightful. Thank you for your time. Now we're going to go observe the patient in their natural habitat and gather some data. What are you doing?
I'm staring at the clock.
Why?
I'm waiting for all 3 hands to line up before I can leave. Otherwise, if I leave before it happens, I'll get cancer and die.
Okay.